Well, welcome back to Soda City Live. May is American Stroke Month, and according to the American Stroke Association, having one stroke puts you at a higher risk for a second one. And today we're going to be talking about some ways that you can both prevent a stroke or identify if someone is in distress. Dan Carroll is an occupational therapist with Encompass Health who joins us today. So glad to have you joining us.
Yes, thank you for having me.
Such a pleasure. And you know what? I really admire the work that occupational therapists do. I don't think people really understand what it is you do until they're in a position where they either need you or a loved one needs you. So I want you to tell us a little bit about what it is you do as an occupational therapist, and then we're going to talk a little bit about what exactly a stroke is.
So what I do is, like, my day starts with me assisting my clients with we call activities of daily living, for them to be able to just simply get up out of bed, bathe themselves, brush their teeth, feed themselves, get themselves to the bathroom. So we're teaching those skills for them to relearn how to do those things again. And maybe then we'll take them down to the gym and we'll work with making sure they can walk, they can use their arms and do things. Can they pay bills? Can they have, functional ability just to think sometimes? While they're at Encompass, they'll get PT, speech therapy, and occupational therapies to work on all those skills.
Now, I know as an occupational therapist, you kind of focus on the rehabilitation aspect of everything, but when a person has a stroke and they go to the hospital, in what ways are they treated? Is there something that stops that stroke process? What do they do?
Well, first of all, we have to really get them active first. I mean, that's because now the brain is kind of cut off and not working, and that's why they're paralyzed. And we have to retrain the brain to do the function. So that's what the rehabilitation is all about, retraining them to be functional again. So the more active they are is what we're trying to do. We get them in, they just come from the acute hospital to us, so they're kind of stable enough to do that. Yeah. So they're not getting worse at that time. So now they should start to see improvement.
Yes, and what areas is the treatment?
So it's the brain. So we're doing a lot of brain retraining, the area of, if it's the right side of the brain that had the stroke, then the left side is going to be affected. If it's the right side, left side, the right side is going to be affected, right? So they have different functions. I mean, they do different things for you. Some of them is talk about your emotions, being impulsive and things like that. So we're retraining you to be able to function normally depending on what side of the brain the stroke was on.
Oh, that's very interesting. I never realized that the treatment is based on what area is being impacted.
Yes.
Now, we do have a full screen. We want to share with you all just the signs of stroke, and it's FAST. Tell us about the acronym.
FAST, the FAST acronym, and we teach our patients this, is the F stands for facial droop. So if you're having any symptoms of facial droop, it's a sign that you may be having a stroke. And the A stands for arm or leg weakness. If any weakness, you may be having a stroke. Slurred speech, any change in the way you talk or the way you receive information, you could be having a stroke. Confusion. And then the T stands for any of those symptoms. It's time to get to the hospital as soon as you can, so that you can, the sooner you get treatment, the better your outcomes and your survival of a stroke. And you may not have as many residual things that we have to work on. You can get this TPN, which is a clot blocking to help remove the clot from your brain so they can restore blood flow.
Well, thank you, Dan, so much for this information, explaining to us what it is that you do to help the people who have had these strokes kind of recuperate. And so I want to thank you for what it is that you do. Again, I want to thank you for joining us today on the show. And we will have all this information on our website, sodacitylive.com. Those signs right there on your screen, take a picture or a screenshot. We'll also have that on our website, sodacitylive.com. Be sure to stick with us. We have much more coming up after the break.